Good morning, everyone. We are here this morning to announce that Austin-Travis County will be returning to stage 3 of our COVID-19 risk-based guidelines. This is due in part to the confirmed presence of the Delta variant in our community and the associated dramatic increase in new cases and hospitalizations that we've seen in the past few days. I'd like to take a moment to thank all of the medical personnel in our hospitals, EMS, first responders, physicians, nurses all over Travis County who have worked so diligently to care for COVID-19 patients. I know that you are weary from this struggle, and we are taking this moment to direct our attention to what we know has worked in the past. We have had two spikes in cases, one last July and one in January, and this community has worked together to reduce those case numbers by doing the things that we know work. We've worn masks, washed our hands, social distance, and stayed home when we were sick. And this must be reviewed and revived so that we can get to the next stage. We want to reopen schools safely, and we want to continue to reopen our economy. And those things can happen if we work together to do so by encouraging our friends and loved ones to be vaccinated and to continue those things that I just mentioned. At the present time, our ICU bed capacity is strained, and largely this is due to the fact that we have a shortage of staff, and we also have more respiratory illness as we've relaxed our masking policy and as there's been more travel and social interaction. This Delta variant that we have now in our midst, as you've heard, is much more infectious. It spreads more rapidly in our community, but vaccines are effective at protecting us from becoming ill, severely ill, and needing hospitalization. And it also protects people from dying. We've seen in the last few days that the increases in our admissions has gone from 7 on a 7-day moving average to 20 to 21 as a 7-day moving average. And our 7-day average for new cases has tripled from 30 to almost 90. This has to stop, and we know how to make that happen. We are now seeing more pediatric cases of COVID-19. And we now are able to vaccinate children 12 and older. So I urge everyone to get their children vaccinated before school begins so that they can go back safely and return to in-person learning. What does stage 3 mean? All of the same guidance is in place for stage 3, except that we ask that those who are high risk, who have chronic disease or immune compromised status, wear a mask if they are in a situation that is going to put them at risk. So they should avoid being indoors in poorly ventilated spaces. They should only engage in essential travel, and if they have to travel, wear a mask. And they should avoid going to places with crowds, and if they have to do so, wear a mask. We are hoping that this self-correction that we're doing with the change to the stage 3 status will help bring us back to a place where our cases are again declining. We are in the process of making a request to the state for help with additional staffing and to reopen infusion centers for monoclonal antibody therapy. We are in constant conversation with all of the stakeholders hospital groups, physician groups, schools, etc., to evaluate the situation, and we will continue to advise as the situation dictates. I thank you for your attention, and I thank you for doing what needs to be done to get us through this phase. Thank you.
Thank you, Dr. Walks. As I think about our conversation today, I'm reminded of something my mother always used to tell me. If you hear something 3 times, it may be true. And this morning, a message that I'm sure you will hear repeated by myself and my colleagues is the importance of vaccinations. Yes, we may be moving back to a stage that we hope was in our distant past, but what's different this time is the information that we have and the proof that we have in the efficacy of vaccines. And so my comments to you this morning are, and it's rather catchy, vaccines can't mutate if they can't replicate. And how do we prevent that? We prevent that by getting vaccinated. We know that the vaccine is highly effective against preventing death and severe illness, even with the Delta variant. As Dr. Walks said, our kiddos are geared up and ready to go back to in-person learning. And we know that is so important for their well-being and their continued progress. And the way that we can support our kids in doing that safely is making sure that they are vaccinated. Pfizer is currently the only vaccine approved for ages 12 and up. And you can get that vaccine at any Austin or Travis County vaccination location. We're in Del Valley. We're at the Expo Center. We're at supermarkets. We'll come to your house. We'll go to your local business. Whatever you need us to do to help you make the choice to be vaccinated, we are prepared. Thank you. I'll turn it over to Mayor Hedler.
Thank you, Director Stirrup and Dr. Walks. You know, this is kind of gut check time for our community. I hate that we are here together again at a press conference talking about the virus. I had thought and had hoped that we would not be in front of you again talking about a rise in COVID cases. We're here because we're concerned about each individual person that lives in our community, especially those that are most in danger right now, those among us that have not yet been vaccinated. We're also here because we see a growing threat to the community as a whole. That's everybody, both those that are vaccinated and those that are not. First, let me speak to those that have yet to get vaccinated, that are not vaccinated. The data is the data and the numbers are the numbers. Almost everyone in our hospitals right now, in our ICUs right now, are people that have not been vaccinated. The numbers on the website today reflecting yesterday's numbers show us that we have 107 people in our hospitals. We have 41 in our intensive care units. We have 21 people in our community on ventilators. And almost all of them are people that have not yet been vaccinated. You know, there are a significant number among us that have been vaccinated. 70% have had one shot, over 60%. Over 60% have been fully vaccinated, and that's real good news. And there's a lot of protection for a lot of people, but that also means that there are 30% of us that have not yet been vaccinated. I know that there are many of those people that are waiting to see what the vaccination experience would be once it rolled out and people started taking it. They wanted to watch and learn, and I understand that. At this point, millions and millions of this vaccine have been given to people all over the world. And the data is very clear. These vaccinations are extremely safe. The risk of not taking the vaccination is greater than any risk associated with taking the vaccination. And we also know that it's very, very effective, not just against the standard COVID, but also against the Delta variant. It doesn't mean absolute protection against getting the virus, but even if you do, if you've been vaccinated, there's a much greater chance that you're going to be able to avoid going to a hospital, ending up in an ICU or on a ventilator or dying. Now, when you're making your individual calculation about whether or not to get vaccinated, and you take into account all of the things that you take into account, there's an additional thing that I want to make sure that you put into your equation when you're deciding whether or not to get vaccinated. And that's the impact on the community generally. Because we know that as we have a growing number of people in our hospitals, as we have a growing number of people in our intensive care units, people who show up at our hospitals sick with COVID are taking up beds. They're taking up services and support and care that our hospitals can give. And if we have as many people with COVID as the numbers now indicate we could get to, then we start getting stressed for the number of beds that are available for people who have heart attacks or are involved in car accidents. Now, we're not there yet, and we're talking today about the early signs of numbers that are rising. And as Dr. Walks and Director Stirrup said, we have control over this in our community. We get to decide, both individually and collectively, if we're going to stress our hospitals with increased number of people. We have control over this. Now let me talk to the people that are vaccinated, because you have skin in this game too, even though you have considerably more protection than those that have not been vaccinated. Because if the numbers in our hospitals rise, that's going to impact our entire community's health preparedness and capabilities. So I urge everyone, people who have been vaccinated included, to make sure that our friends and our families get the information and data that they need in order to be able to make the choice to take the shot to get vaccinated. If you're an employer, help your employees get vaccinated. Do everything we can to help try and get the vaccination level in our community rising to the degree and point that collectively as a community, we don't have to be going back to places we have been in the past, but we have to protect our hospitals. You know, I would want to make sure that we thank our nurses and our doctors, healthcare workers, for everything that they've done over the last year. We have a mortality rate in this county that is half of what it is in the state, half of what it is in the nation. And that's because as a community, we have worked together, and it's because of the support we've had in our medical community. I know you guys are exhausted right now and tired, and I promise you that this community is going to do everything it can to protect you and to keep you safe. And finally, I would conclude with, we cannot pretend that we are done with a virus that is not done with us. I'm now going to turn it over to my colleague, Judge Andy Brown.
Thanks, Mayor. I know I'm no Olivia Rodrigo, but I still hope you'll listen to me and what we're saying today and take our advice. You know, I obviously care about this because I'm your county judge, because I grew up here in Austin, and because my wife and I have two kids who, frankly, are too young to get the vaccine. So it's up to you, it's up to your family, it's up to your friends to get vaccinated, because our youngest kids still cannot get vaccinated. Today's stage 3 announcement and the news from the Public Health Authority is a commitment from our doctors to continue to communicate the latest that as we learn it about the virus. And the guidance hasn't really changed. The best thing to do still is to get vaccinated. That's the way to keep our community safe. That's the way to protect against the variants the Delta variant and whatever other variants are coming out there. So if you haven't gotten vaccinated yet, it's not too late to do so. And fortunately, we're not lacking in the number of places where you can get vaccinated today and this weekend. There's across Travis County, 14 different places where you can get vaccinated. For example, the Travis County Expo Center is open on Saturday and Sunday from 9 a.m. to 5 p.m. for a drive-through clinic. It's completely free. You don't have to have an ID card. You don't have to have insurance. And would encourage you, if you are vaccinated, get a friend of yours who maybe has been putting it off, a family member who has been reluctant, and let them know that this is the time to get vaccinated, because this is the only way that we're going to get rid of COVID for good. You can get the other locations of the other 14 places to get vaccinated at traviscountytx.gov. Also, if you own a business or if you're part of a business that wants to get your workers vaccinated, we have options for you as well. You can contact Austin Public Health, as Adrian mentioned earlier, to get this set up. And more than anything, we're also calling on businesses, governmental entities, any working environment to give people time away from work to ensure that that is not a barrier for anyone wanting to get the vaccine. If you're able to get vaccinated, please don't wait. The more people in our community who are fully vaccinated means that our kids and teachers can safely go back to school, our community's live music scene and restaurants can be safely enjoyed, and we'll all be able to avoid any more preventable deaths to this awful disease if we all get vaccinated. But don't wait. This is the time to do it. If you've been waiting, this is the voice telling you that you should get vaccinated now. I'm going to say a little bit of that in Spanish now. El consejo de nuestra autoridad sanitaria local no ha cambiado. Lo mejor que puede hacer para protegerse contra el COVID-19 y mantener a nuestra comunidad segura es estar completamente vacunado. Las vacunas son seguras y protegen contra los nuevos variantes como el Delta. Si aún no se ha vacunado, no es demasiado tarde para hacerlo hoy o este fin de semana. Afortunadamente, no nos faltan lugares y oportunidades para vacunarnos. Solo este fin de semana, en todo el condado de Travis, tenemos más de 14 lugares donde puede vacunarse. Son completamente gratis, no requieren seguros ni tarjeta de identificación. Por ejemplo, el Expo Center del condado de Travis está abierto el sábado y domingo este fin de semana de 9 de la mañana hasta las 5 de la tarde para vacunas y que puede obtenerlos desde su coche. También tenemos una lista completa de estas ubicaciones disponibles en traviscountytx.gov. También puede hablar al 311 si tiene preguntas sobre dónde vacunarse. Thank you very much, and I will pass it on to the next speaker.
That would be me. Thank you, Judge Brown. At this time, we will open up our questions on behalf of the media. Austin Sanders, on behalf of the Austin Chronicle, will start asking questions at this time. Austin, over to you.
Thanks. Yes, Austin Sanders with the Chronicle, and this first question's for me. We've been talking a lot about the importance of getting vaccinated and the new goal of having 70% of the county population fully vaccinated by September 1st. What kind of new programs or initiatives can the city or the county implement to help our community reach that goal? And I think specifically among populations that have lower vaccination rates.
Thank you for that question. I'll start and then invite my colleagues to add. Since the vaccine has become available between all of our community partners, we've given over 400,000 shots. We've used a variety of methods from mass clinics to community-based static locations at our libraries. And now we're moving to the phase where we're really taking our show on the road. The Travis County Collaborative has several offerings at different JD supermarkets and other locations within community. We're really trying to be in places where people work, play, pray, and live. We've partnered with many churches on the East Side to host vaccine clinics, and will continue to do so. If you are a business, a community organization, a church that would like to host a vaccine clinic at your location, there's an online form that can be found on our APH website that you can fill out, and we can schedule our team to come out and meet with you. We're at this point in the game where we really need to be intentional in our focus and the messaging. It's available, right? And now we have to give people enough information so they feel comfortable in making the choice to get themselves and their family vaccinated. To that effort, we are going to continue to partner with the county to deploy boots on the ground operations to come be in your neighborhood and not necessarily give the shot on that first day, but be available to answer any questions that you may have, to disseminate information about the vaccine so you can read the information for yourself, have a chance to digest and talk with your friends. And if we get to the point in our conversations after we show up day after day after day, because we will direct you to one of our vaccine locations. We're proud to have invested, the county and the city have invested in local community organizations, because we know at some point we might not be the face or the voice that the person wants to respond to. And we're going to have to lean on our community partners that have deeper and connected relationships with people when we're trying to convince them to make this very personal decision. And so we will continue to partner with those community-based organizations, providing resources, information, shots, whatever it is that we need to have this collective community approach to ensure that we are giving everyone enough information and enough opportunity to get vaccinated. We will continue to have low barrier options. Gone are the days where you had to stand in a queue in the internet world looking for a vaccine shot. You can come to any location where we are without filling out any paperwork and get a vaccination. You can call 311 if you have questions. They'll direct you to our nurse line. Our community care clinics and other community clinics are open and available to answer questions of folks. It's all about making connections at this point, and being there. We are committed as a community, as a county, as a city, to be there to provide the information and to provide the vaccinations.
I'll jump in on that one too. Just a couple of the things. So we did the mass vaccination clinics that were great when tons of people wanted to get it and would drive to do it. And we have not stopped since then. Now we are going to where people are. We have been doing that for the last several months in an effort led by Constable George Morales and Chief Bailey and Ascension Seaton and others, and in partnership with APH and Travis County. For example, today, if anybody wants to get a vaccine, there are 4 JD supermarkets that will be giving them out with our teams from Travis County after 5:30 p.m. today. One on Cameron Road, Decker Lane, FM 812, FM 535. This afternoon, also Little Walnut Creek Library, Southeast Library, LBJ Early High School, AISD UT Lamar Middle School, Elgin High School, Virginia Roberts Recreation Center, Turner Roberts Recreation Center, and Avance Anita Coy Center on Gonzalez Street. There is no lack of places where people can go today, tomorrow, this weekend to get a vaccine. And as Director Stirrup said, you can also call 311 to schedule a time if you want to set up a vaccination at a church or another place of your own, or at your employer.
All right, thanks. I'll move on to the next question. It's from CBS Austin, and they ask, were the people who tested positive for the Delta variant in Austin vaccinated for COVID? In other words, were any of these breakthrough cases?
I'll take that question. We just received those reports yesterday, and our case investigators are gathering the information. So we don't have the full picture at this point. But we will get back with you when we have more complete information.
Okay, thanks. Next, we have a question from Community Impact. With ICU capacity strained, is there any concern that APH will need to stand up its alternative care site at the convention center?
At this point, we are evaluating the situation, and when we see that the situation dictates scaling up our resources, we will take those steps to do so. At this point, we are requesting that we get some staff help from the state of Texas, and that's where we are at this point.
Okay, the next question is from Fox 7. I'll come back to them. We got one from KOP Radio. According to a recent analysis, there are 5 low vaccinated clusters that could put the entire country at risk. 2 are in Texas, and Houston has reported evidence of every known variant. How does that impact the vaccinated and the unvaccinated in Austin, Travis County?
What that tells us is that we need to redouble our efforts to continue to do what we've done to decrease the number of cases in our county. We need to do what we're doing today, which is encourage people to go and be vaccinated. And for those who are unprotected because they're either not vaccinated or partially vaccinated, encourage them, strongly recommend to them that they wear masks until they are completely protected. Vaccines work to prevent severe disease and illness and hospitalizations and death. And so that is the goal, is to get us to a point where we have the number of people in our community that are protected, that's sufficient to call it herd immunity, that stops the virus in its tracks and ends this pandemic.
Okay, back to the question from Fox 7. Is there an attrition issue with hospital staffing that is contributing to the possible strain on resources?
I think the hospitals are reporting to us that their staffs are certainly tired and have gone through a considerable year. And yes, it is harder to get qualified nurses and qualified healthcare folks now than a year ago. So that becomes one of many factors that are considered in looking at the capacity that our intensive care units have.
Okay, next from the Statesman. Several organizations and nonprofits have started to take it upon themselves to hold vaccine clinics in their communities. What resources and help is being provided to those groups?
I'll start and then invite my colleagues to add as they see fit. I, for one, am glad that our community-based organizations are playing a role in this. We've been saying from the beginning that we're going to get there together. As the judge mentioned, since the inception, between APH Community Care and the Travis County Collaborative, we've given over 400,000 vaccinations. We've worked together to get to the 70% goal of first doses, which is huge. And so I applaud our community partners for stepping in and stepping up. And we are here to support, whether it's providing vaccinators, whether it's transferring doses that we may have to support events, whether it's providing translation assistance, or even simply promoting the events. We understand that we're in it together. We also understand that some organizations, as I said before, may be more uniquely positioned to meet the needs of our historically underserved populations. And so we're there to support in any way possible.
Thanks, Director Sturb. And just to focus on that again, overall, we were very happy with the 70% of people who've gotten at least one dose that we announced last week. But that doesn't mean that everywhere in the county, within the county, that we've achieved those same results. And so we're still working very hard until every zip code within Travis County, every neighborhood within Travis County is at those levels where we feel like we're getting to herd immunity. So we're not there yet. We have not stopped working on that, and we're very happy when community organizations, Capital Metro, the National Guard, Ascension Seton, everybody pitches in together to get vaccine rates increased all across Travis County, and we're not going to stop until we get there.
I also think that a lot of the events that are happening around the community that are being done by community organizations are actually backed up by Austin Public Health or by Travis County and the like, and that might not be apparent on its face because we're doing everything we can to empower local organizations and local community groups to do this kind of thing. We think that's probably one of the best ways for our community to reach the levels that we need, especially in those communities that are hard to get to. So as Director Sturb said, we're all in this together and we're all supporting one another.
Okay, our next question is from KXAN. Which COVID vaccine did the people with breakthrough cases get before they got COVID? Some are concerned the Johnson & Johnson one-dose shot isn't as effective as the two other vaccines.
So we have data on patients that have had breakthrough cases, and we are analyzing that data to make a determination as to the effectiveness of the vaccines. Currently, the science shows that all of the vaccines that we are using are effective at reducing severe disease, illness, and death. There is some preliminary information to suggest that J&J is not quite as effective as the Moderna and Pfizer vaccines, but our data is still being reviewed.
Okay, thank you. Next from KUT, what's the breakdown of hospitalized?
Before you move past, let me just add to that all three vaccinations are still real effective, especially at preventing hospitalizations and ICUs. I took the J&J vaccine personally and feel very confident that the steps that I've taken, the steps my daughter took, taking the same vaccine, are protecting us from those, at the very least, from those severe situations. And at this point, there's no CDC recommendation to do anything else, to booster that or anything. The numbers are just so high among all three that I think the real takeaway is that whatever vaccine you can get still is the right vaccine to take because they all are very effective in fighting both the standard virus as well as the Delta variant.
Correct. All of the vaccines are very effective at preventing severe disease, illness, and hospitalization. So please get vaccinated.
All right, thanks for those additional comments. From KUT, what's the breakdown of hospitalized patients who have been vaccinated versus unvaccinated?
We know that the majority of patients who are hospitalized are unvaccinated.
Okay, thanks. From KView, did all 4 people test positive at the same healthcare center or testing site in Austin, or are they spread out? are any of the people who tested positive for the Delta variant hospitalized?
Our preliminary information shows that people were tested at various places, and we know that one person is hospitalized.
Okay, thanks. Next from Estonia. What does demand for vaccine appointments look like at Austin Public Health and Travis County providers right now?
I'll start. It's not where we would like it to be. If you've been following the briefings, there's no secret that the amount of vaccines that we've been able to give successfully week over week have dropped off. That being said, we will continue to have our locations at the Southeast Library, at the Little Walnut Creek Library, and in other places. Mobile will be there. We will continue to provide vaccines until we reach the place where our entire community is protected.
Okay, from Univision, we know the Delta variant has been in Texas for a while. Why are we just now detecting the first cases? Have we not been testing for the variants?
There's been limited sequencing done, testing for variants done because of limited access to that capability. And so the testing that's available through the state is being done on patients who are hospitalized or patients who have died. And the other places locally where testing is being done are Baylor Scott and White system and UT system. But because of the limitation in the availability for sequencing, we have not identified anything up until yesterday when we received those confirmed reports.
Okay, thanks. Back to the top and another question from me. So it seems like, there's plenty of vaccine supply and ability to administer the doses, but the demand isn't there. So have the city or the county considered some kind of lottery system that other states and communities have done to encourage people to get vaccinated?
I think you're muted,
We,
Dr. Walks.
oh, well, I'll start, and then if Dr. Walks would like to chime in, we'll surely give her the space to do so. The city and the county have talked about various ways to incentivize and make it easy for people to become vaccinated. Several of the surveys that we have distributed through community show that people are concerned about taking time off work and loss of wages. And so to be able to provide support by means of gift cards is something that we've worked on as a community. I know Central Health has started that process at several of their locations. And the city and the county continue to work together to see what resources that we can bring to bear to expand and augment those programs.
Okay, CBS Austin asks, what can Austin Public Health do to get a more accurate picture of how widespread the Delta variant is in the Austin area? Can more testing for the Delta variant be requested or supplemented?
The state is currently working on augmenting our capabilities with regards to sequencing. However, going forward, we're identifying people who have COVID. We are asking them to stay at home and isolate in their own room using their own bathroom to mitigate the spread, to prevent the spread of COVID in our community. That's what we do, whether it's the Delta variant or the original novel SARS-CoV-2 virus that we started with. If they are sick enough and have severe enough disease to require hospitalization, that's going to continue just as is. So our ability to do sequencing is being addressed. Our ability to treat and identify is still the same and will continue as is.
Okay, thanks. From KOP Radio, there has been no word on a viable vaccination for those under 12, while summer camps are having outbreaks and the school year approaches. What is your advice to AISD?
We are aligning ourselves with the CDC guidance, and will continue to do so. We are urging those who are eligible for vaccine, 12 and older, to go and get vaccinated. And we are also strongly recommending that people who are unprotected wear masks.
Okay, from the Statesman, data shows that several zip codes east of I-35 sit below 50% vaccine coverage. What is the city and county doing to get those people vaccinated?
I'm happy to start on that one. So as soon as we finished, kind of wound down the Circuit of the Americas mass vaccination clinic, we moved to the Expo Center, which is also located in Eastern Travis County. But more importantly, Constable George Morales and Chief Bailey, who's the fire chief of ESD 11, partnered with Seton and Travis County and APH to actually have teams that go out focusing on those same zip codes and those same precincts that you're talking about in Eastern Travis County to try to get the numbers there up to above 50%, which I think that we have done in one zip code at least, and we're not going to stop working until we get them all above that level and beyond. And so it's hard work. It's not, you can't get the same numbers that you get when you've got 15,000 people coming per weekend to Circuit of the Americas. But it's important, and I think up now, from when they started till now, I think they've hit about 18,000 doses have been given, I believe, through that effort. And we're looking at ways to expand it, given the new issues with the Delta variant, and any way that we can do it in partnership with the city and other groups, we're going to do it. Just looking at the map of the different clinics that are open today and this weekend, some are being done by APH, some by Travis County, some by Constable Precinct 4. Most of them a partnership of those groups. Capital Metro is partnering with one at JD's Supermarket. The National Guard or the State Guard is coming in to partner with Travis County at another JD's Supermarket. UT, it's a group effort, and we're still working at it, and we're not satisfied yet with the result, but we're still working to increase those numbers.
And I think most, if not all, of the efforts are really focused on the non-distributed measures that you've heard about earlier in the press conference. Many, if not most of them, are being targeted to those areas that you asked about.
And I'll just add to that quickly. Weekly, the teams look at that first dose penetration map, and we overlay that with places we've been and we plan to be, and we're really using that data to drive our strategy. More recently here, we've asked the city demographer to prepare a profile of the residents in those zip codes. So when we're thinking about everything from our messaging to the method of delivery, We're taking those data points into consideration and carefully constructing a strategy around that.
And we are now also looking back at survey analysis and follow-up to make sure that our strategies are working and to also make any adjustments to those strategies. We understand that those communities are the hardest hit communities when it comes to disease and death. And we also recognize that almost all of the people who are being hospitalized at this point because of severe disease and death are from communities that have been adversely impacted by COVID-19 throughout this pandemic. So we are really, really focusing on trying to get as many people vaccinated as we can. And the collaboration from the city and the county and our community partners will continue to be necessary so that those trusted voices are heard and those people that are unvaccinated receive vaccinations.
Okay, thanks. Our next question is from KXAN. They ask, are you asking vaccinated people to return to masking?
At this point, we are looking at the situation and we will make any adjustments to our guidance as we continue to evaluate. But at this point, we are asking for people who are unvaccinated and unprotected to wear a mask.
Yeah. Right now, what we're asking people to do is to get vaccinated. And then that's the number one thing that people can do to protect our community. It's all of us working together to vaccinate and convince people who are not yet vaccinated but eligible for it to get a vaccination. It's not to say, like my kids who are 4 and 6, when they went to a summer school program, they wore masks every day. I encouraged them to do that. I would wear a mask when picking them up from school and things like that. I think that population under 12 is of particular concern to me. I've obviously got two folks in that category because they can't get vaccinated yet. But I think the thing that we are all asking everybody to do and that we really want to focus on and that will make the greatest difference for our community is just going to get vaccinated today, tomorrow, this weekend. There's no more time for delay.
The only change in masking that comes about by going to phase 3 is that people who are most vulnerable or at risk are now being recommended that they put on a mask regardless. And as Dr. Walk said, if there's anything further to be done, we'll be taking a look at that. But to Judge Brown's point, the most important thing right now is for people to get vaccinated.
Okay, a question from KUT. Have you seen a decrease in the number of people getting tested? If so, does that mean that we might be underestimating how present the virus is in the community?
There has been a decrease in the number of people who are being tested, and that's largely impacted by the fact that the symptoms of COVID-19, sore throat, runny nose, cough, headache, loss of smell, taste, diarrhea, those are things that are also symptoms of other disease and illness. So we are asking people to go and be evaluated by their healthcare professionals so that they can be diagnosed. And if they are diagnosed with COVID, isolate themselves at home in their own room with their own bathroom so that we can contain the spread of this illness. That's what's worked in the past, and that's what's going to work as we go forward.
Okay, thanks. And our last question here is from Univision. They ask, moving back to stage 3, you are asking people to voluntarily mask up. are there any actions the county or city will be taking in the future to implement our own masking ordinance?
At this point, we are not planning to do anything along those lines. We are committed to evaluating the situation. We will have ongoing conversations with policy leaders and medical leaders and school boards and all of the stakeholders to assess where we are in this pandemic and what the need is for us to take action.
Thank you, Dr. Walks. At this point, we will go into our closing remarks. Dr. Walks.
I would like to thank our community for their resolve to bring this pandemic to an end. And I would ask that you join us now as we recalibrate this situation. We're asking you to, if you're vaccinated, speak to your friends and family and colleagues and ask them to go and get vaccinated if they're unvaccinated. Tell them that it's safe. Redouble the education efforts and letting people know that vaccines prevent severe illness and disease and hospitalizations and death. We need your help. We need to get through this. Austin, we have done it before. We can do it again. We can bring the numbers down. We can protect our hospital systems. You can thank your medical professionals by going out and getting vaccinated. They are tired. They've been doing this for 18 months. Please get vaccinated. Let's do this.
Thank you, Dr. Walks. Definitely want to give a shout out to our medical professionals, but would be remiss if I did not acknowledge the work of Austin Public Health and countless city and county employees that have been in this from the beginning, providing boots on the ground support from testing to vaccination. And so my hat's off to you. I'm proud to serve with you. And I know that we can continue to do this together. Being a reflective person, every morning I wake up and think about what my legacy can be in this world. And it's changed as I've experienced life and grown older. And I think most of the time it's centered around my two kids. And when I think about the impact that I can have with respect to the personal choice that I make around COVID vaccine, because I'll be honest, I was one of those people, I was dragging my feet in the beginning. But when I thought about this one small action that not only protects myself, but protects the community which my kids are growing and playing in. Every person that's vaccinated, not only are you protecting yourself, but you're protecting your loved ones. We're limiting the chance that this virus has to mutate. And so for yourself, for the love of your partner, for the love of your children, for the love of your big mama, your abuelita, whoever it may be, I encourage you to take the shot, any shot, J&J, Moderna, Pfizer. The data shows that they are all effective in protecting us from COVID and protecting us from severe disease and death. Thank you for your time today. We're here if you have any questions.
Director Stirrup and Dr. Walks, again, thank you and your staffs for what you're doing. The Travis County judge and the health officials there, the constable, the chief. There is so many people working so hard to try and keep the community safe, and I want to make sure that we're thanking all of them. But bottom line, we're here today because we're seeing now a serious uptick in numbers of people in our hospitals and people in our ICUs that have COVID. That's why we're here. We're here because almost all of those people are not vaccinated. The early indications of what we're seeing now could develop into a really serious challenge for our health system as a whole. And that's why we're here. But as a community, we can control this. We need people to really consider, if you're not vaccinated, getting vaccinated. Look at the evidence, look at the data, look at the millions of people that have had it. Know the numbers that we're seeing in our community, where almost all the people being hospitalized in the ICUs are not vaccinated. And recognize that as the numbers go up in our hospitals and in our ICUs, there's a challenge that's presented to the overall healthcare system. Maintaining spaces in hospitals and ICUs is important for reasons that go beyond COVID, so that there are beds for people having heart attacks or involved in automobile accidents. There's something that we can all do. If you're not vaccinated, please get vaccinated. If you are vaccinated, please make sure that all your friends and family that are not get vaccinated. We're still at a place where we can control this, and that's what we're asking the community to be on heightened alert. I am really enjoying going back to a life that is more open and more free and looks more like the kind of life we had before. But know that our ability to do that is precarious, and we need to hold on to it, work to hold on to it if we're going to keep it. And finally, I'll repeat what I said before: we cannot pretend to be done with a virus that is not done with us. Judge?
Thanks, Mayor. Yeah, I agree with what everyone said. Get vaccinated. Think about if you're not vaccinated, or more likely, if you have a friend or a family member who's not, make a plan for today or this weekend to get vaccinated. You can go tonight to any JD's supermarket from 5:30 to 8:30. This weekend at the Expo Center from 9 a.m. to 5 p.m., both Saturday and Sunday. Just make a plan, put it on your calendar, and that will make all the difference in the world if everybody does that this weekend. Thank you.
That concludes our media availability for today. Thank you to Travis County Judge Andy Brown, City of Austin Mayor Steve Adler, Interim APH Director Adrian Stirrup, and Austin Travis County Health Authority Dr. Desmar Walks, and to our pool reporter Austin Sanders from the Austin Chronicle. Thank you again for joining us. Please have a safe day.